Hi, I'm Gary White for Channel 6 Central Kentucky Television. I'm here with Ann Harrison. We're here to talk about an event that's going to be coming up at St. Catherine College on Thursday, September the 6th. And it is a second in a series of sorts of programs that has been sponsored by the Washington County Democratic Women's Club, but it's open to everyone, a nonpartisan event about healthcare, right?
That is correct. We have a healthcare subcommittee, and we felt that one of the greatest needs, after we did a survey of about 100 people in the region, we realized that one of the greatest needs was for people to be educated about healthcare access. There's been a lot of steps and missteps and firing and misfirings about healthcare access in regard to Medicaid, Medicare, the Affordable Care Act. And so Ben Chandler from the Foundation for a Healthy Kentucky came last year to start this conversation, and he did a really wonderful job educating us about not only about healthcare access, but also about health of Kentuckians and what we might need to be considering to improve the health of Kentuckians.
Okay. Now, this time when he's coming back, you have some different topics you're going to be discussing, including the issues with Medicaid. Is that correct?
That is correct. So this year, I think it was this year, the state government was able to get the national government to provide or give Kentucky a waiver to the Medicaid expansion program that was created under the Affordable Care Act. And that waiver is a waiver that would require work or service for people receiving Medicaid, which is, about 500,000 people in Kentucky. So what we anticipate, and what the research bears this out, is that with the waiver, probably 90 to 100,000 people would lose their insurance, their Medicaid access, and that means they would lose their access to health care for the most part, except for emergency room care, which is kind of taking us back to the old days where everybody went to the ER for their primary care. So the Foundation for a Healthy Kentucky has taken on as one of its missions an effort to try to educate people about the waiver and help people figure out how not to lose their Medicaid insurance. They're also going to talk not just about Medicaid, but that certainly will be one of the focuses, but they're also going to talk about what's happening with Medicare. We'll be asking them questions about anticipated cuts to Medicare as a result of the high deficits at the national level. And then I've asked them to also speak to some of the changes in general to the Affordable Care Act, as well as other issues related to healthcare access at the national level. This is a lot to cover in an hour, but I think in a nutshell, these are all such complicated issues, but I think in a nutshell, they'll be able to give us some really important information. And at the end of their presentation, we'll have a question and answer session so people can bring their questions. They're both attorneys. They're both very involved in policy. It's Ben Chandler and Veronica Judy Cecil, who's the vice president for the foundation. Ben is the president. They both have a long history of working in policy issues in Kentucky, and I think we'll be able to field questions about what's actually happening, as well as anticipation of what could happen.
Now, we were talking about the Medicaid waiver. That has been put on hold at present, correct?
That is correct. So the Medicaid waiver was enacted, and then I believe it was taken to court by the Attorney General, and then a judge put that on hold, and there was a recent open discussion, and people had an opportunity to actually open comment period on their concerns about the Medicaid waiver. Our concerns about healthcare access in general is that healthcare access through insurance, whether it be Medicaid, Medicare, Affordable Care Act, private insurance, it's so complicated. And so people have such a hard time understanding. Many of us are fortunate enough to get our insurance through our companies. And so we just let them handle the complications. But for people who don't have that kind of opportunity, which is about half of Kentuckians who get their insurance through Medicaid and Medicare, and only about 7% are on using the Affordable Care Act to get their insurance, but still, their lives matter too. And so we thought an educational forum to help people learn what to do and what to anticipate was in order.
Absolutely. Now, again, the program is going to be held on Thursday, September the 6th, and where is it going to be?
It's going to be at St. Catherine it's called the Meeting Hall, which is actually at the back of the Mother House. If you know St. Catherine, or if you don't know St. Catherine, it's at, I think it's 2645 Bardstown Road, but it's just outside of Springfield, in between Springfield and Bardstown. And the Mother House and the women who live at the Mother House have kindly allowed us to use the Meeting Hall at the back of the Mother House. So if you just come to St. Catherine's campus, we will have signs. You will not have any trouble finding it. It's at 6:30,
okay.
And it goes to from 6:30 to 7:45. We anticipate question and answers will probably push us into that 8 o'clock time period.
And it is a free program that's open to everyone.
Absolutely free.
Right.
And we really hope people come, because we think education will empower us all to figure out what to do about our health care.
Right.
So.
And again, so Thursday, September the 6th, 6:30 p.m., it'll be at St. Catherine's in the back of the Mother House. Everyone is welcome to attend. For your health care, what's at stake? And I've been talking with Ann. Thank you very much.
You're welcome. Thank
and
you, Gary.
Everyone is welcome to come on out.